From Colorado's high-definition news leader, this is 9 News at 5.
There's a Colorado company breaking some new ground in the fight against cancer. Up next, these techniques. Doctors are very, very excited about them. We'll talk about them in just a bit. Doctors are using words like revolutionary and exciting to describe a Centennial company's technique to diagnose and treat cancer. 9 News medical reporter Dr. John Torres says the developments being made by CellPoint could offer new hope in the fight against cancer.
First, let me explain that CellPoint is developing 2 different products. One is a diagnostic tool that will help doctors diagnose and examine the cancer tumor. The second is a therapeutic tool that will actually treat the cancer. So far, the clinical trials are very promising. Researchers at the University of Texas MD Anderson Cancer Center first discovered the technique that attaches chemicals to glucosamine, basically a molecule of sugar. The fast-growing cancer tumor gobbles up both the sugar and a small amount of radioactive isotope.
We're able to actually get inside the tumor,
allowing this relatively cheap and widely available SPECT camera to take pictures of the glowing tumor.
This is an image from our clinical trials. The cancer is localized in this area here.
Today, doctors have to use this scarce multi-million-dollar PET-CT scanner to get similar images, and patients receive high doses of radiation.
You can get a less expensive image, which is more sensitive and has less radiation exposure to patients.
Oncologist David Schrier is also excited because this tool allows him to scan a patient during chemotherapy and quickly see whether the chemo is working.
Which will help us determine, does a patient need chemotherapy changed after 2 weeks, or do we have to wait 8 weeks or 12 weeks?
Which means significant cost savings.
And we've estimated close to a savings of about $20,000 per lung cancer patient.
The therapeutic tool works in a similar way, delivering a drug inside the cancer cells.
This is sort of one of the first times that you're able to take a therapeutic like a cold metal or radium-187 and take it into the nucleus of the tumor.
Traditional chemotherapy drugs can have serious side effects, but this new therapy could allow patients to have a normal life while being treated.
And that's what's got us excited, is it has less toxicity. You don't get sick from it.
But what could be the biggest breakthrough is that this therapy might be able to treat many different types of cancer.
An agent like that with a low side effect profile that's readily available and effective could really take the horror stories out of cancer treatment.
The diagnostic tool could get FDA approval this year, but the therapeutic tool will take a few more years. Trials are just beginning now, and it will take a bit longer before researchers know if this one therapy can be used to treat many different types of cancers. I'm Dr. John Torres, 9 News.
For more about CellPoint and its new techniques for fighting cancer, look for this story on our homepage at 9news.com.